Have you ever felt insecure or dissatisfied with the size of your penis? If so, know that you are not alone. This is a common concern among many men. But before we begin, it is important to clarify that the information shared here does not replace medical advice. Nothing discussed should be implemented without first consulting a specialized doctor. Deciding on unproven methods or unsafe procedures can not only be ineffective but also harmful to your health. Watch until the end to discover the little-known secrets that can transform your confidence and your sex life safely and effectively. Imagine how your life could change by gaining more confidence and satisfaction with your body. Have you ever thought about the positive impact on your intimacy? So if you want to transform your sex life and feel more powerful than ever, stay with me. Don't waste a second and discover how these techniques can revolutionize your performance and self-esteem. Are you ready for this change? Let's talk about techniques for increasing penis diameter and what science says about them. I will explain each technique, highlighting studies and scientific evidence that help us understand which ones are truly effective and safe. There are many products and procedures out there, such as nutraceuticals and vacuum devices, injections of substances such as silicone, hyaluronic acid, and even autologous fat, which is fat taken from the patient themselves, that promise miraculous results. But do they deliver what they promise? Let's figure this out together. Nutraceuticals, which are often marketed as natural solutions to increase penis size. Substances such as Tribulus terrestris and Peruvian maca are common in these products. Tribulus terrestris and Peruvian maca are often promoted as natural solutions to increase sexual performance and, by extension, penis size. However, it is essential to understand that the effectiveness of these supplements, especially in terms of permanently increasing penile diameter, is not supported by robust scientific evidence. The 2019 study, published in a renowned medical journal, examined several techniques and products, providing a critical and scientific view of their effectiveness and risk, and concluded that, despite some potential effects on libido and erectile function, these nutraceuticals do not alter the physical dimensions of the penis. Additionally, inhibitors such as tadalafil and sildenafil, known to treat erectile dysfunction, are also used by some in hopes of increasing penis size. These medications work by increasing blood flow to the penis, which can result in a firmer, longer-lasting erection. But, like nutraceuticals, they do not permanently modify the penile structure. It is crucial that consumers are aware that the effect of these medications is temporary and specific to erectile function, and does not provide a real increase in penis size. Precisely, the 2019 study provides a critical assessment of these products, highlighting a crucial truth. There is no scientific evidence to support the effectiveness of nutraceuticals and inhibitors in permanently increasing the diameter or length of the penis. This conclusion serves as an important reminder for anyone seeking solutions to concerns related to penile size, emphasizing the need for caution and the search for informed information. In addition to not providing the promised results, using these products without proper medical advice can pose health risks. Many of these supplements do not undergo rigorous quality control, and inhibitors, when used inappropriately or without a prescription, can cause serious side effects such as heart and vision problems. This highlights the importance of not getting carried away by promises of quick and miraculous results, especially when these promises are not supported by concrete evidence. Vacuum pumps and fat injections are two distinct techniques that some men explore in hopes of increasing penis size. Let's detail the operation and use of each of these options. When activating the pump, air is extracted from the cylinder, creating a vacuum that induces blood to flow to the penis, enhancing the erection. This method is often used as a solution to erectile dysfunction, but some men use it with the hope of increasing the size of their penis. Although it may provide a temporarily larger appearance due to increased blood flow, scientific evidence confirms that the use of vacuum pumps does not result in a permanent increase in the diameter or length of the penis. Fat injections involve transferring fat from a part of the body, such as the abdomen or thighs, to the penis. The procedure begins with liposuction of the patient's own fat, followed by the purification of this fat, which is then injected around the penile tissue. This method aims to increase the diameter of the penis by adding volume to the existing tissue. However, as pointed out by the 2019 study, the results tend not to be long-lasting and may include complications such as irregularity in the shape of the penis, reabsorption of injected fat, and, in rare cases, more serious reactions. The 2019 study was quite insightful in examining the effectiveness of penis enlargement techniques such as the vacuum pump and fat injections. The results obtained show that, although some techniques can offer a temporarily larger or more erect appearance of the penis, there are no sustainable improvements in size in the long term. This demystifies many of the promises made by products and procedures that take advantage of personal insecurities to sell quick solutions. In addition to the lack of permanent results, the study also highlighted possible complications associated with these techniques. In the case of fat injections, for example, complications can include uneven reabsorption of fat, resulting in irregularities and asymmetries in the penis. In more serious cases, inflammation and even deformities may occur, requiring additional corrective interventions. With vacuum pumps, risks include vascular or penile tissue damage if used excessively or inappropriately. These findings highlight the importance of a cautious and well-informed approach. Men considering any form of penis enlargement should first consult a urology specialist. This professional can offer evidence-based guidance and help set realistic expectations, minimizing the risk of disappointment and complications. Subcutaneous implants, such as mesh or other synthetic materials, represent another approach that has been explored to increase the diameter of the penis. These implants are inserted under the skin of the penis to try to add volume or structure. However, as the study points out, the results of these methods have been largely unsatisfactory and, in many cases, problematic. The studies analyzed reveal that although it may initially appear that there is an increase in diameter, many patients face long-term complications. Among the most common issues are rejection of the implant by the body, the formation of excessive scar tissue, and the occurrence of penile deformities. These reactions can not only negate any perceived gain in size, but can also worsen the aesthetics and functionality of the penis, leading to a reduced quality of sexual life. Furthermore, the need for additional surgical interventions to correct or remove problematic implants is a reality for some patients. Such procedures can be complex and carry additional risks, highlighting the importance of meticulous medical evaluation and careful consideration before opting for these penis enlargement techniques. The penis extender is a device that relies on the principle of traction to potentially increase the length of the penis. Unlike other techniques focused on increasing girth, extenders are designed to gently extend the penis over time, which could theoretically result in an increase in length through promoting cell growth. According to the 2019 study, although some users saw a modest increase in penis length after consistent, prolonged use, typically 4 to 6 hours a day for several months, results in girth were virtually non-existent. The study highlights that there was no substantial improvement in the diameter of the penis, which confirms that the penis extender may not be the solution for those who want to increase the thickness of the organ. Additionally, it is important to note that using penis extenders requires commitment and consistency, and even with these efforts, results can vary significantly between individuals. Comfort and safety during use are also concerns, as inappropriate use can lead to discomfort, pain, or even injury. Corporoplasty is a more invasive surgical technique used mainly to correct penile curvatures, but also explored to increase the diameter of the penis. The procedure involves using the saphenous vein, a large vein that is usually taken from the patient's leg. The vein is prepared and then used to make grafts in the corpora cavernosa of the penis, which are the structures responsible for maintaining the erection. The process begins with the surgical removal of a segment of the saphenous vein. This segment is carefully treated and prepared for transplantation into the penis. The surgeon makes incisions in the penis and implants the vein segment in the corpora cavernosa, seeking to increase its volume and, consequently, the diameter of the penis. This is a delicate procedure that requires surgical precision and in-depth knowledge of penile anatomy. The idea behind girth enlargement corporoplasty is that, by adding volume to the corpora cavernosa, the penis will be able to achieve a larger diameter when erect. However, it is important to note that this procedure is considered experimental for increasing diameter and is still under investigation to determine its long-term effectiveness and safety. Patients considering corporoplasty should be aware of the associated risks, including possible postoperative complications such as infections, healing problems, and potential effects on erectile function. A detailed discussion with an experienced urologist and plastic surgeon, if necessary, is essential to evaluate the options and fully understand what to expect from the procedure, as well as its possible benefits and limitations. The corporoplasty technique, although promising, remains largely in the experimental stage when it comes to increasing penis diameter. The prospect of using the saphenous vein to enlarge the corpora cavernosa presents an innovative approach, but studies to date are limited and results are variable. The potential of this technique lies in its ability to provide a physical increase in penile volume, which is a substantial improvement over non-surgical methods that do not show permanent changes. However, studies to date indicate that although some patients may see improvements in penis diameter, these results need to be evaluated in the long term to verify their sustainability and safety. Furthermore, the complexity of the operation and the associated risks, such as graft rejection, infections, or even impact on erectile function, require further investigation. It is essential that more research is conducted to establish a clearer understanding of the benefits, limitations, and possible complications of penile enlargement corporoplasty. Given the current state of knowledge, patients interested in this technique should proceed with caution. It is advisable that they seek the opinion of experts in urology and reconstructive surgery and consider participating in clinical studies that can offer a more rigorous and monitored evaluation of the effects and results of this surgical approach. This could not only provide access to new therapies, but also contribute to the body of scientific knowledge, helping other men with similar concerns in the future. As explored throughout our discussion, the 2019 study examined several techniques aimed at increasing penis diameter, including the use of nutraceuticals, vacuum pumps, fat injections, subcutaneous implants, penis extenders, and the corporoplasty technique. A clear review of the results of these techniques revealed that, in most cases, the methods did not provide permanent or significant improvements in penis size, and in many cases, they were associated with risks and complications that could compromise sexual health and function. Given this information, the most prudent medical advice is to emphasize the importance of seeking reliable sources and qualified medical care before beginning any penis enlargement procedure. It is vital that patients understand that many of the solutions offered on the market lack scientific support and can even be harmful. Consulting with a doctor and openly discussing concerns and expectations can help avoid hasty choices and ensure that any decision made is informed, safe, and in the patient's best interests. In short, knowledge is the key to making informed decisions in the search for improvements in well-being and sexual health. If you found this video informative and useful, don't forget to subscribe to the channel and click the bell to receive notifications whenever we post new content. Your participation is essential so that we can continue to provide valuable and updated information. Furthermore, we would like to hear your opinion and learn more about your questions or suggestions for topics for future videos. Leave your comment below with questions or topics you would like us to explore. Your interaction is very important to us, and every comment helps shape the content we create for you. Participate and be part of our community.